India gets ready from midnight today for curbs at all airports on international travellers from nearly 60 at-risk nations. Here's the latest report from correspondents from across the country on what's happening and what this actually means. The big changes in the new SOP if you arrive from an at-risk nation at an international airport is that you have to test at the airport, wait for your result, and even if you're negative, you then go to a home quarantine or a hotel quarantine.
International airports around the country lining up chairs, preparing to test hundreds of passengers at a time, starting midnight. No passenger can leave until their RT-PCR test result is out, which can take up to 4 to 6 hours. Anybody who tests positive will be shifted to hospitals and their samples sent for genome testing for Omicron. And the rest will be sent for a mandatory 7-day home quarantine in Mumbai. However, no mandatory quarantine in Delhi.
High risk country पे है RT-PCR पॉजिटिव भी आएगी तो जीनोम सीक्वेंस की भी टेस्ट होगी. ओमिक्रॉन का जो डर लग रहा है वो होना नहीं चाहिए. हर एक पैसेंजर सेल्फ डिक्लेरेशन देगा कि वो कौन से कनेक्टिविटी कंट्री में जाके आए हैं.
Chief Ministers of Delhi and Maharashtra, which have India's two biggest airports, have asked the centre to ban international flights.
भगवान करे कि ओमिक्रॉन वायरस इंडिया में ना आए. अगर वो आता है तो एक जिम्मेदार सरकार होने के नाते हमारा फर्ज है कि हम अपनी सारी तैयारियां पूरी कर लें. तो आज मैंने सभी विभागों के जो भी संबंधित विभाग हैं उनके साथ मीटिंग की और उससे निपटने के लिए जो तैयारियां करने की जरूरत है उनका जायजा लिया.
In Delhi, COVID positive passengers will be brought here to LNJP hospital, now designated for Omicron cases.
We have made special preparation. We have had the separate isolation ward, treatment ward, and at the same time we are training our staff to handle with such the cases. We have lot of international travelers, so if any cases are referred to us to the Loknayak, we can handle such cases, we can isolate them, we can treat them, we can do the gene sequencing. Our hospital is competent enough to deal with such different type of viruses.
Delhi is beefing up health infrastructure, 63,000 beds, creating a 2-month buffer stock of essential medicines, a storage capacity of 442 metric tons of oxygen, 3 refilling plants that can refill 2,900 metric tons of oxygen. The centre has advised states to allow physical visits by state officials to homes of passengers from at-risk countries for effective home isolation, and to implement emergency COVID response package with focus on rural areas and children, and early implementation of sanction, oxygen plants and cylinders, drugs, etc. The centre has also said that Omicron variant can be detected by both RT-PCR and rapid antigen tests.
The emergence of Omicron variant of COVID-19 has come out as a major challenge to the entire world and a grim reminder that the virus is still present and a threat to the entire humanity. And while the healthcare workers are working on war footing to prevent another wave of COVID-19 in the country, it is also a responsibility of the public to adhere to COVID-appropriate behavior. With camera person Sushil Rathi and colleague Parimal Kumar Sinha, I'm Akshay Dongre for NDTV.